Imagine there's a hidden enemy in your body, lurking silently, making plans to spread, and it's not easy to find. This enemy is prostate cancer. It's one of the most common forms of cancer in people assigned male at birth and the second leading cause of cancer death in the US. Early detection can save lives, but how can you know if it's spread? Enter the PSMA PET scan, a game-changing tool that lets doctors see exactly where prostate cancer is hiding. 1. What is a PSMA PET scan and why does it matter? A PSMA PET scan is like a spotlight that shines on prostate cancer cells, helping doctors locate them with precision. PSMA stands for prostate-specific membrane antigen, a protein found on prostate cells, but in much higher amounts on cancerous ones. The PSMA PET scan combines this with positron emission tomography (PET) to create a detailed map of where these cells are in the body. Why is this so important? With other imaging tests, some cancer cells remain hidden, but the PSMA PET scan increases the chances of finding them by 27% compared to older methods. This can mean the difference between catching cancer in time or allowing it to spread unnoticed. 2. How does the PSMA PET scan work? Here's the process. Step 1. A doctor injects a radioactive tracer into your arm. Think of this as a beacon that is attracted to PSMA proteins. Step 2. You wait for about an hour while the tracer travels through your body, attaching itself to prostate cancer cells. Step 3. You lie in a PET scanner, a big, donut-shaped machine that takes pictures of your body for about 20 minutes. The result? The radioactive tracer lights up the cancer cells, showing exactly where they are. Doctors can then see if and where the cancer has spread, all from a single scan. 3. Who should consider a PSMA PET scan? Not everyone with prostate cancer needs a PSMA PET scan, so let's look at who might benefit the most. New diagnosis, high or moderate risk. If you've just been diagnosed and your doctor thinks your cancer could be spreading, this scan could offer critical information. Cancer that's suspected to spread. When cancer spreads beyond the prostate, it becomes more dangerous. If a doctor suspects this, the PSMA PET scan is an excellent tool for confirming it. Post-treatment recurrence. If you've been treated for prostate cancer before but it may have returned, a PSMA PET scan can help doctors identify lingering cancer cells. This scan gives doctors a better picture of what's happening inside your body, allowing them to make more accurate decisions about your treatment plan. 4. How does the PSMA PET scan compare to traditional imaging? The PSMA PET scan isn't the only imaging option, but it is one of the most effective. Studies have shown that it's not only more accurate but also more sensitive and specific than traditional imaging methods. For example, traditional imaging methods like MRI or CT scans can sometimes miss small clusters of cancer cells. The PSMA PET scan, however, lights them up, making them much easier to spot. This accuracy allows doctors to detect prostate cancer cells with more certainty and to stage the cancer more accurately. In simple terms, the PSMA PET scan doesn't just tell doctors if cancer is there, it also shows them how aggressive it is and whether it's staying in place or on the move. 5. Preparing for a PSMA PET scan, what to expect. Preparing for a PSMA PET scan is straightforward. Here's what happens. Injection of the tracer. You'll receive a small injection of a radioactive tracer in your arm. It's painless and feels similar to a regular injection. Waiting period. You'll then wait for about an hour while the tracer spreads through your bloodstream and attaches to prostate cancer cells. The scan. Finally, you'll lie down in a PET scanner for about 20 minutes. It's non-invasive and completely painless. Because the radioactive substance is attracted to PSMA proteins, cancerous cells light up on the scan, revealing whether the cancer has spread and if so, exactly where. 6. Why accuracy and early detection matter. Detecting prostate cancer as early and as accurately as possible is vital. The more precise the detection, the better chance doctors have of developing an effective treatment plan. The PSMA PET scan provides critical information that can help target treatments where they're needed most and prevent unnecessary procedures. Think of it this way, it's like finding the exact location of a fire in a massive forest. The sooner you know where it is, the quicker you can put it out before it spreads. 7. Common questions about the PSMA PET scan. Q1. What does a PSMA PET scan cost? The cost of a PSMA PET scan can vary, depending on where you are in your insurance coverage. Some insurance providers, including Medicare, may cover the cost. It's always best to discuss out-of-pocket costs with your healthcare provider beforehand. Q2. Is the PSMA PET scan safe? Yes, the radioactive tracer used is safe, and the amount of radiation is low. It's a common imaging technique, and the body flushes out the tracer after a short period. Q3. How long does the entire process take? From start to finish, expect to spend around 1.5 to 2 hours, which includes the hour-long wait after the injection and the 20-minute scan. Q4. How reliable is the PSMA PET scan? Studies show that the PSMA PET scan has better accuracy than traditional imaging. It's 27% more effective in spotting prostate cancer, giving doctors more reliable information to work with. 8. The takeaway: why PSMA PET scans are a game changer. Prostate cancer doesn't need to remain a mystery. Thanks to advances in medical technology, the PSMA PET scan offers a way to look into the body and reveal exactly what's happening. It's a tool that can lead to more targeted treatments and better outcomes. In the battle against prostate cancer, information is power. The PSMA PET scan helps put that power in the hands of doctors and patients alike. If you or a loved one is facing a prostate cancer diagnosis, talk to your doctor about whether a PSMA PET scan might be the right choice.